Right here. Good morning, everyone. My name is Nirav Shah, and I am the director of the State of Maine Center for Disease Control and Prevention. I'd like to provide everyone an update on the COVID-19 situation across the state. As of this morning, the Maine CDC is reporting 376 cases of COVID-19 across the state. That's an increase in 32 cases since yesterday. There have been no new deaths. That is to say, the total number of individuals who have passed remains at 7. In total, 68 individuals have been hospitalized at some point in their illness with COVID-19, and a total of 94 individuals have recovered. That represents an increase in 14 recovered individuals since yesterday. As of right now, 68 of the total cases are healthcare workers in the broadest definition of healthcare worker. And as of right now, there are no new counties in which community transmission has been detected, although our disease detectives are looking for evidence of community transmission in counties like Kennebec County and Penobscot County. That's in addition to the 2 counties in which community transmission has already been confirmed, Cumberland and York. I'd like to provide a brief update on the Department of Health and Human Services office in Lewiston. As of right now, that office remains closed until further notice. And once that office is reopened, we will provide an update on that. I'd like to turn now to a brief update on laboratory testing. Yesterday, just under 600 samples were shipped to LabCorp for testing. As a result of this, Maine CDC at present has no testing backlog while we await the samples being tested at LabCorp. We continue to make sure that our laboratory is focused on returning rapid results to the highest concerns, patients who are our highest priority, which is to say individuals who are ill in the hospital for whom healthcare workers need a quick response so that they can guide clinical decision making. And that right now continues to be our area of focus, as it is with public health laboratories across the state. I'd next like to provide an update on our work to acquire as well as distribute personal protective equipment across the state. Again, personal protective equipment is a life-saving set of equipment that has been in national shortage for several weeks now. Just this morning, Maine CDC placed an order for 300,000 KN95 masks from a vendor here in Maine with whom we work quite a bit. We are also preparing to make a very large distribution of personal protective equipment starting tomorrow, working with our colleagues at the Department of Transportation. And at tomorrow's briefing, I'll have more numbers on exactly what is being distributed across the state. In terms of the availability of key assets, as of right now, there are 285 total ICU beds across the state, 122 of which are available. There are approximately 334 ventilators across the state, of which 266 are available. There are also available 186 of the alternative ventilators that are now authorized for use by the United States FDA. Before we turn to questions, I'd like to take a moment to address something that's come up and something that's been on my mind right now, which is that where we are in the outbreak, a lot of folks are looking for quick answers. But unfortunately, those might not yet exist. And into that vacuum can often come fear, misinformation, or outright mistruths that can spread far more quickly than the virus itself. Where we are in this outbreak is such that there is no pill, there is no shot, there is no vaccine. And as a result, the best vaccine that we have available to us is physical distancing right now. But in the absence of a drug, there are rumors and reports of other remedies that are out there. Now, we know that there are scammers out there. Sadly, that's always a fixture in any time of emergency or crisis. And I, of course, urge everyone to be cautious for offers and solicitations from any individual who might be trying to sell something directly. But I'm not now just talking about scammers and hucksters and charlatans. I'm also talking about individuals who are well-intentioned but may inadvertently be spreading information that's just not quite factually accurate. So what I'm asking everyone to do is to exercise caution and maybe even some healthy skepticism when reading information, even from the best intentioned folks. And specifically, I'm asking everyone to help their friends and family members separate fact from fiction here. That's what we've been doing in my own household. The best way to be informed in a situation like this is to consult trusted sources of information. Perhaps that's the Maine CDC's website, the US CDC's website, or, for example, for information about particular tests that have or have not been approved, the US FDA's website. But consulting with experts as you exercise that healthy skepticism is the best way to make sure you are armed with the best, most accurate and complete information. And given where we are right now, that is the best way to keep you and your entire family healthy. We're going to turn to questions. And for folks who are watching, we have tried to abide the same physical distancing requirements that we have been talking about here. So here in the briefing room, it's me, the gentleman operating our camera, Dr. Thibodeau, and our gentleman working on the computer, but the reporters are actually on the phone. And so today's briefings going forward will be, our media colleagues will be joining us by the phone. So I'll go down the list and call on them, and we'll manage the briefings going forward that way. So I'd like to start first with Amy Brown from WERU. Go ahead, Amy.
Thank you, Dr. Shaw. Can you hear me?
I can. Go ahead.
Okay, great. Can you say anything more about the response stage at Oxford Street Shelter that you mentioned a few days ago, and possibly elaborate on what's being done to help shelters in general as well as people who are homeless across the state?
Great. Amy's question is, where are we with respect to the Oxford Street and situation, as well as more generally, what work is being done to plan, prepare, and respond, and ultimately help people who are experiencing homelessness. So first, with respect to Oxford Street, Amy, there are now 2 confirmed individuals who are associated with the Oxford Street shelter. Our team of epidemiologists, as well as public health nurses, are deeply engaged with shelter management and city officials on the epi side, to look at the investigations to determine who might have been a close contact of either of those cases, and then on the public health nursing side, to provide nursing and clinical support to those individuals as they are being assisted by city management. For as long as we have been thinking about COVID-19, given the way that we know it spreads by respiratory droplets in close contact, individuals who are experiencing homelessness and who live in congregate settings have been one of our top priorities. We've been meeting and working with city officials as well as social service providers across the city to plan for this exact scenario. And so now we are putting those operational plans into action. In general, we're working to make sure that individuals who have signs and symptoms can get test results as quickly as possible, that those who are positive are offered safe places where they can recover and minimize the likelihood of transmission. And for those who are exposed, they're placed in a safe setting so that if they develop symptoms, they can be cared for quickly. I'm going to cycle through everybody, and then we'll pick up follow-ups as we go through. So I'd like to turn next to Beth Brogan from News Center. Beth, go ahead. Beth? Okay, we'll come back to Beth. I'd like to turn next to Steve Missler.
I'm here. Oh, is it too late?
No, it's not too late, Beth. It's never too late. Go ahead.
What I was doing. I apologize. I had emailed my questions in too, but you've previously used some of the country top zones comparison. So given that and the model that the federal government is using, I think the state must have some projections for what is likely to happen in Maine. And I know the numbers are scary, but I'm wondering if you have estimates of how many confirmed cases we are likely to see, given what's happened elsewhere, and potentially, an estimated death toll from it.
So Beth's question is around the modeling and any estimated death toll that we may have. And what I will say is that whatever the death toll may be, it will be far too high for all of us to bear ultimately. What we do in our modeling exercises is not so much try to project what something might look like at the peak, but rather to come up with different planning scenarios so that if any of those scenarios were to come to fruition, we have matched the scenario with the needed assets that we might have. So it's less about generating a number and more about making sure that we've got necessary assets to match whatever number that might be. As we've gone through our modeling exercises, one of the things we realized was that our initial request of ventilators wasn't quite at the mark we wanted it to be. And so we've asked the federal government to increase that request for ventilators from 300 initially to now 400. We're urging the federal government to fulfill that request to make sure that if one of the worst case scenarios were to materialize, we've got as much support as we can here in Maine.
Can I ask a quick follow-up?
Sure, Beth.
The Washington Post reported today that the national stockpile is almost completely depleted. Where would those come from?
So Beth's question is about the national stockpile. And we, Beth, received similar word from the national stockpile with respect to PPE. We received word that the shipment of PPE that came in earlier this week may be the last such shipment that Maine receives for quite some time. The same can be said with respect to ventilators. Now, there are efforts at the national level to produce additional ventilators that could be then diverted into the national stockpile and sent out to states. But we in Maine are not relying solely on the federal government for assistance here. We are also looking into different strategies, including purchasing ventilators on our own, again, to make sure that if any of the worst case scenarios were to come true, we would be equipped for that. But we continue to ask the federal government to do their part as well to try to keep states fully equipped. I'm going to turn next to Steve Missler. Steve, go ahead.
Thank you, Dr. Shah. I appreciate it. Every day you, you provide an inventory of ventilators, and you just referenced the number and a request for more. And I'm just wondering whether you know if you have enough respiratory therapists to run them. I think the Bureau of Labor Statistics puts Maine's number of respiratory therapists between 170 and 590. That's a pretty big range. I'm just wondering if you know if you have a census of people who would be available to run these things. And if you don't, I know that you've asked for volunteers or people who are recently retired from the workforce to come back and help. But if that doesn't work, what other strategies might you utilize?
Good. So Steve's question is around ventilators and specifically the staffing that we may need to operate those ventilators. And Steve zeroes in on one of the most critical members of the ventilation or critical care team, which are respiratory technicians and respiratory therapists. These are the folks that work alongside clinicians as they manage critically ill patients. And as Steve notes, that has been an area that we have focused. I do have the number today of the number of respiratory technicians in Maine as reported to us by hospitals. And that number as of today is 127. Steve, you noted a wider range. One of those numbers, I think at the upper bound, is the number who are licensed. Our number is reported to us and is probably a reflection of the number who are actively practicing. So there is, of course, a range in all of these numbers based on how we acquire them. But we survey hospitals, as we do for all valuable assets, and respiratory technicians, that number standing at 127 today. Now, as we think about our modeling work, we make different assumptions based on how many individuals, how many ill patients different healthcare workers could manage. For example, how many ill patients could a critical care doctor manage when those patients are ventilated? We make similar assumptions for respiratory technicians. So as a result of that, we have asked respiratory technicians to volunteer in the event that they might be needed to deploy to another part of the state. The same goes with folks whose licenses have been recently expired. If that number were to prove to be insufficient, our backup plans or our alternative plans rely on a couple of different things. The first is cross-training other individuals in closely allied fields for possibly coming into service as a respiratory technician. The second is to see if other states may have a surplus of respiratory technicians who may want to deploy to Maine. This may include, for example, states whose place in the outbreak is several weeks ahead of us. Whose respiratory technicians may not be needed as much there. But make no mistake, Steve, your question is spot on. It's something that we've been thinking a lot about, and it recognizes and acknowledges that it's more than just a healthcare, it's more than just a physician and a ventilator that's needed. It's an entire support staff. I'm going to cycle through folks, and then we'll pick up some follow-ups if that's okay. I'd like to go next to Brad Rogers at WGME.
Hi, Dr. Shaw. One question here. We're hearing from multiple people who say they've been waiting 2 weeks or more for test results. What would cause a delay like that, and how do you hope these rapid tests are going to help moving forward?
Great. So Brad's question is around some of the delays that we've seen in testing. There has been a delay in testing in the state of Maine, across the country. And that's not acceptable to us. One of the reasons we decided to work with an outside company was to try to ensure that tests that are submitted can get tested even if they aren't in one of the highest focus groups that we are focused on, like folks in the hospitals. And so I can't speculate on any one individual, Brad, but for example, someone who did not have any symptoms, who may have been tested. That might be someone whose test is going out to LabCorp for testing, as opposed to somebody that would have been tested at the Maine CDC, where we're focused on individuals who might be in the critical care unit. Now, Brad, you note the rapid tests, and that could certainly help as well. We are developing a strategy for how best to maximize the use of those rapid tests, but certainly for a number of folks for whom we'd like to get results to faster, these rapid tests will be a really critical part of the healthcare landscape. So much more to come on the rapid tests once they are received and once we start deploying them. I'd like to turn next to Don Kerrigan over at News Center.
Yes, good morning, Dr. Shaw. Question about how do people know, or how will people know when they have recovered from the virus? I believe the previous guidance had been 2 negative tests as well as showing no symptoms. But if it's difficult to get those tests done, how is that still the guidance?
Great. So Don's question is about what do we mean by recovery? I mentioned today that 94 individuals have recovered, an increase of 14 such individuals from yesterday. And what do we mean by that? There are two different ways that someone can be classified as having recovered from COVID-19. One is by follow-up lab testing that is negative. The other was it was announced by the US CDC over 2 weeks ago. And this other mechanism or this other pathway toward recovery relies on the resolution of symptoms. So one pathway relies on follow-up testing. The other, more common pathway relies on a certain number of days after someone has stopped feeling any symptoms, chiefly the resolution and the absence of any fever, of any cough, or any shortness of breath. So what happens in these situations, Don, is that our field epidemiologists keep touch with patients and keep tabs on them. And after they have met this criteria, which are available on the US CDC's website, our field epidemiologists say to patients, you have satisfied this criteria to show that your symptoms have resolved. And based on the data that the US CDC has collected, the risk of transmitting coronavirus to anybody is as close to zero as we can have it. And that's when we deem someone to be recovered. And that's when we say that they can go back to their normal life. So there's two ways: symptomatic recovery or lab testing recovery. And right now, most states are finding that the symptomatic pathway is where folks fall into. I'd like to turn next to Kate Koff from the Ellsworth American.
Thank you, Dr. Shaw. As you noted a little while ago, there's not yet any approved treatment available, and we've had reports from other states of prescribers inappropriately prescribing certain medications for themselves or for their family members, kind of just stockpile things. I'm wondering if you've had any reports of that in Maine, and if you're considering any measures to restrict the filling of certain prescriptions, if that is something the state is even capable of doing.
Kate's question is about various treatments that are out there. And Kate, as you noted, as of right now, there has not been any single treatment that has been definitively shown with scientific standards of a double-blinded randomized trial to be uniformly effective. That is to say, it's another way of saying the science is still looking at the best treatments. But there are reports out there of different drugs that are being studied. And there are similarly reports that I've seen in other states of stockouts of those drugs. Now, the decision of whether and when to prescribe any medication for any COVID-19 patient is one that ultimately is between a physician and his or her patient. And we don't stand in the way of that. We have not heard, or Kate, we're not aware of reports of the practices that you noted occurring in Maine. We are keeping an eye out, but as of right now, we're not aware, we haven't heard of any such reports. I'd like to turn next to Samantha Hogan from Pine Tree Watch.
Thank you. I wanted to just follow up and find out what the Maine CDC's conversations are currently with MEMA in regards to a medical surge. You've said that cases are likely to continue to increase while we have medical ICU equipment and vents right now. What are you guys doing to look a little bit down the road in case that overwhelms any hospital?
Great question, Samantha. So Samantha's question is around what we might do in the event of a medical surge. And Samantha, as you know, we have been planning for those scenarios as well, working very closely with our colleagues at MEMA, as well as with other state agencies, such as the National Guard, the Department of Transportation, and other logistics support. So Samantha, there are two ways to think about the type of surge capacity that you're referring to. The first is to set up sort of external hospitals or external areas where individuals who may have signs and symptoms of COVID-19 would go for a quick medical evaluation and triage. That's one set of plans that's underway. Another set of plans that's being developed or that are developed is for what amounts to an external hospital. So more than just an alternative triage site, but a full-scale external hospital. Both sets of plans are underway, and what we're looking for are signs that in the future we might need to deploy one or the other. Now, we're preparing right now to deploy the former, to be ready to stand up these sorts of external triage sites very soon. But we're also thinking about situations in which we would need to erect what amounts to a field hospital. Now, that might involve converting a disused building into a hospital. It might involve working with existing hospitals to expand space. So there we've worked with our colleagues at, for example, the Army Corps of Engineers to try to get a better handle on what the state resources are and the availability of state buildings in case any type of conversion of that sort might be needed. So a lot of active planning underway, and I do really thank our colleagues at MEMA who have been standing by us and working with us since we started this activation several weeks ago. I'd like to turn next to Rachel Ohm from the Portland Press Herald.
Hi, Dr. Shaw, can you hear me?
I can. Go ahead, Rachel.
Okay, yeah, my question is about long-term care facilities, and do you have any update on the number of cases that have been at long-term care facilities and, just whether they have been heavily impacted?
Rachel's question is about long-term care facilities. And given what we've seen occur with COVID-19, especially at a particular long-term care facility in Seattle, King County, long-term care facilities continue to be a very top priority of ours across the state. In addition to congregate settings generally, long-term care specifically has been a focus area. There are no new cases of COVID-19 affiliated with nursing homes that we're reporting today. We'll get you the exact number of total cases at nursing homes in just a bit, Rachel. But again, suffice to say that since day one, we have been working with long-term care facilities to make sure that they are on the front, knowing that they're on the front lines, to make sure that their healthcare workers are aware of the signs and symptoms, to try to equip them with PPE, although we recognize that that has been a challenge, and then make sure they are aware of how they can get patients tested very quickly. I'm going to do a quick rapid fire because we've got several more people on the line, and so I'm going to just try to run through these really quickly. My apologies if we don't get to every single person today, but we will try our best. So Megan from WMTW, you're up next.
My question is about when you give the number for total ICU beds, for example, or total hospital ventilators available. Can you tell me or us how many of the ones that are being used to treat COVID-19 patients specifically?
Great. So Megan's question is, of the beds and ICU beds that are available, how many are being utilized for COVID-19 patients? That's not information that hospitals are reporting into us quite yet. So that's a question that we're looking at and trying to figure out the most efficient way for hospitals to report that information to us. I don't have those numbers for you right now, Megan, but we'll see what we can do to get those to you. I'm going to turn next to Caitlin. Oh, go ahead.
Does that mean quickly that you don't know total hospitalizations for COVID-19 patients? Is that fair to say?
No, I don't have that number for you right now.
Okay.
Yep.
Okay.
Yep. Caitlin Andrews at the BDN.
Hi. Yes, Dr. Shaw. I wanted to follow up on your comment about external medical units. Could you give me a better sense of when that might be coming online and how would that unfold?
Sure. So we're looking in the next week to week and a half to stand up an external medical site. The details are being worked out with hospital systems right now. And so no final decisions have been made in terms of locations, but our focus is on locating those sites in the areas of highest need and starting partly with a triage system so that individuals who are not feeling well can start there, but they may also be equipped to do more acute care. Again, Caitlin, we're working with the hospital systems right now, so no final decision has been made on as to either location or staffing. Those details are being worked out. Once we've got a final plan in place as well as the deployment date, we'll provide an update on that. I'm going to go to Ashley Blackford at WAGM.
Hi, Dr. Shaw. So far, there have not been any confirmed cases here in Aroostook County. Do you believe that's because there aren't any cases here, or are there cases and the test just hasn't been processed yet?
So Ashley's question is about cases in Aroostook County and whether there might be actual cases there. Ashley, it's difficult to speculate, of course, but what we've seen is that there are cases around Aroostook County, including across the border in Canada, and there are cases south of Aroostook County. And so there is good reason to believe, just from an epidemiological standpoint, that there already are cases in Aroostook County. And for that reason, we continue to urge everyone in the state, statewide, no matter which county you are in, to continue taking steps to prepare, and as of the governor's executive order, to stay inside. This is one of those situations where one of the best things that you can do to keep your family safe is to stay inside. I'm going to turn next to Steve Betts from the Courier-Gazette.
Yes, thank you, Dr. Shaw. With all the information you have now and the models that you've looked at, what's your best estimate on whether the executive order will be needed after April 30th?
So Steve's question is whether the executive order, presumably the one to keep safe and healthy at home, may be needed after April 30th. And Steve, I don't think I can speculate about what might be needed after April 30th. What I can tell you is that what we know about the science of COVID-19 is that physical distancing is the best way to interrupt the virus's natural transmission. What I can also assure you is that our team of epidemiologists is monitoring the data on a multiple times per day basis to try to get a better sense of whether all of these measures collectively are flattening the curve. Now, the order in which we may remove some of these measures will be driven by the data. So there's not necessarily a date under which we will say, we're all done, everyone. We're going to continue looking at the data in the same way we've introduced these measures based on the data. When the data suggests it's safe to remove them, that's what we'll do. I'm going to go to Dustin from the New England Cable News Network next.
Hi, Dr. Shaw. What more can you say about how the plan to separate the healthy homeless, exposed homeless, and isolated homeless in Portland was developed with your team?
So, Joe, what I can tell you there is that we've been working very closely with not just the Maine CDC team, but teams across the Department of Health and Human Services, other agencies within the Department of Health and Human Services, as well as other agencies across Maine state government, for example, the Maine State Housing Authority, et cetera. So that's been the state government involvement, but we've certainly have involved city officials very early on. The city planner, the city manager, the city's lead of Health and Human Services, as well as, of course, social service agencies within the city. So the plan, and so it's been developed in concert with all of those actors to make sure that everyone is on the same page as we go forward. Now, this is a lot of actors, and I recognize that, and so I really do thank all of those groups for coming to the table and working with us. And as you noted, Dustin, the plan is based on in different categories of folks. There are some folks who are in the shelter that we want to be able to stay there. There are others who may have been a close contact of one of the two cases that we've got. We want those folks to be safe, but also be monitored so that in case they develop symptoms, they can be rapidly taken care of. And then there's the individuals who sadly are not well, and we're providing medical as well as other wraparound supports for them. One of the things that we considered very early on in our planning is not just the medical needs of the population of folks experiencing homelessness, but the other social needs. We know that rates, for example, of behavioral health and behavioral health concerns run higher in the homelessness population than they do without. So we've included in our planning provisions to make sure that folks who are grappling with all types of behavioral health conditions are provided support services as they themselves are contending with the virus. Just as one example. I'd like to turn, and thanks for the question, Dustin. I'd like to turn next to Paul Dwyer over at WABI.
Hi, Dr. Shah. Thanks for taking the question. Obviously, this is on a different scale, but it was reported recently that the NYPD has over 1,400 employees that have tested positive for coronavirus, over 6,000 officers out sick. Here in Maine, a lot of departments are very small, so an outbreak would be really costly, obviously. Can you talk about how the Maine CDC is working with our first responders who, out of the nature of their jobs, still have close contacts with people?
Paul, that's a great question. And Paul's question is about our concern for first responders out there of all stripes. The men and women who serve in uniform, be they from the police department, fire and EMS rescue, as well as the healthcare providers that we've talked about. Those are groups that we have been especially concerned with. From a testing perspective, they are some of the highest areas of focus for us. From a planning perspective, our colleagues at the Department of Emergency Medical Services, Director Sam Hurley, was one of the first people outside of Maine CDC who joined us at the table many, many weeks ago in early January to start working with us on these exact issues. What we're thinking about right now, Paul, is a few things. The first is that given the high frequency of interaction that the men and women who serve on the front lines have with members of the public, we want to keep them safe. In fact, one of the first distributions of protective equipment that we made, a lot of it went to local fire, EMS, and rescue, knowing the frequency of interactions they have with frontline folks out there. The second thing we're doing in addition to keeping them safe is making sure they can get tested quickly. The third thing that's on the horizon for us is to work with the various employers, for example, emergency management agencies, to ask them to help us keep tabs on the health of their staff, so that if they're not feeling well, we can make plans to make sure that the people for whom they provide services to can continue to remain safe. So those first line responders have been top of mind for us ever since we started this work, and we're doing everything we can to keep them safe. We had a lot of folks on the phone today, and so thank you everyone for dialing in, for our colleagues in the media. I know it's not the same as being in the same room, but given the world that we're in, I do appreciate everyone rolling with this and helping to do these media briefings via the phone. I just want to end with the note that I mentioned earlier, which is that we're in a world right now where folks are seeking answers. My colleagues and I in the scientific community are seeking answers as well. But those answers may not be as immediately available as we want them to be. And into that void, into that vacuum, can flow incorrect or outright wrong and perhaps sometimes dangerous information. So I ask everyone, as you're looking for those answers, exercise a healthy dose of skepticism. I also ask everyone out there that has friends and family members who might be looking for those answers to help them find reliable sources of information. Go to the Maine CDC's website, go to the US CDC's website. What we don't want to happen is for fear and misinformation to spread more quickly than this virus. So thank you very much, everyone, and I'll look forward to chatting with everyone tomorrow. Thank you.